Hi everybody, I'd like to acknowledge that I'm on Whadjuk Noongar land here in WA and pay my respects to elders past, present and emerging. I acknowledge that they never ceded and I love their connection to land, water and culture to the country. And I also want to acknowledge the elders of the lands on where you might be standing right now and pay my respects to those elders as well. I'm Hayley Solage, Care Peer Engagement Officer at Helping Minds in Western Australia. And I'm just going to tell you a little bit about me so that you understand that I'm coming from a position of understanding and carer perspective. I'm a carer of 5 family members and we're currently living well. Yay! We did this because we got access to knowledge and that transformed our whole family. So this messaging that I gave to clinicians was really based on my own personal experience as well as best practice in the industry. We're in recovery after 2 decades of complex trauma. There's intergenerational trauma that we've experienced as a family, and I have a lived experience of mental illness. I had postnatal depression following the birth of my 4th child, who's now 19. So that experience is well and truly in my history. I'm also the carer co-chair of the National Mental Health Consumer and Carer Forum, where I get to sit on committees at the top level of government in Australia and help them understand the value of change, changing the mental health system, understanding carer perspective and consumer perspective. I'm also the founder and chair of Women Can International. So how I managed to do this hope into action through the training that I was providing to clinical teams was I helped them to understand how they could become a bridge for families to cross over and get the access to supports and information that could then transform their lives, just as I had experienced with my family when I started working in a mental health service as a carer consultant. Didn't know I was a carer until I applied for the job, and then over the period of the next couple of years, as I was exposed to information, found out about support service, were able to get that to come into my family. Our whole family transformed and we were living well. And that's just been in a few short years. So this message that information is power and knowledge is power, and people who share information and knowledge is powerful was what I shared with the clinical teams, and I got an amazing reception back from that. It's just awesome. So the Practical Guide Training Project was funded in 2019 by the WA Mental Health Commission. We had a significant interruption of COVID. So they were very gracious and extended our contract for a year, and I picked up the contract in August 2020 and was the main facilitator for the delivery of the training. We were contracted to deliver to 8 sites, and in total I delivered to 15. And it was a wonderful project, amazing opportunity. Carers don't get the opportunity to talk to clinicians like this. So I feel very privileged to have had these conversations with clinical teams, and I'm going to tell you some of my observations from those conversations. So the delivery was interactive. I used the opportunity to get to understand the clinical practice, what the gaps were in the service and what the attitudes were towards engagement with carers. So we delivered into 15 public mental health sites. 5 of those were inpatient and then 10 were community. 13 were in Perth metro area, and then there were 2 in the regional and remote. So that was the Wheatbelt and Pilbara regions that I delivered training to. And it was just an amazing opportunity. I absolutely adored this opportunity to have these conversations with clinical teams. And I'm going to go through what my observations were now. So what are my observations from these very rich conversations with clinicians? Well, these were some of the consistent things that I noticed. That they were uncertain how to manage the conversation when consent is withheld and what information to share with families. So I was able to address that and to give them some tools to help break down the conversation and to know what they could and couldn't share. They're also uncertain how to manage upset and angry carers. So what they do, they ignored them or they fobbed them off. And so we had to address that. And how I did that was to talk about what their responsibility was. And I said, well, your responsibility is to manage at the moment. You got someone upset and angry in front of you. You don't have to fix them. That's not your responsibility in the moment, but you do have to acknowledge them and think about ways that you could support them that are not going to take up too much of your time because you've got other responsibilities. And one of those is referral. Refer them to a service that can do advocacy, that can help them understand their rights and work through their grievances, that does carer peer support, so that they've got someone that understands what they might be going through, that's been on the journey, is able to be empathetic, and someone who can help them find the resources that they need or gain the skills that they need through counselling. These are services that Helping Minds provides, and other services provide these in other states. So it's about accessing the resources that sit around you, but not ignoring. Ignoring hurts carers, and I can't stress that enough. If you ignore somebody, it hurts them. Don't ignore them. Find a way to work with them. And at the very least, validate that they're upset or angry. I can see you're angry or upset. It's not difficult to show compassion. So we had that conversation, and that was a really rich conversation. I heard that staff, nurses in particular, are a bit frustrated about being excluded from treatment planning, especially in inpatient units, and also with doctors that don't call back family members. And I understand there's probably 101 legitimate reasons because they're so busy, but the downside is that nurses are having to deal with those frustrated carers who are not being contacted back. So there has to be some way we can address that. They were very grateful for gaining a better understanding of carer perspective, and quite frankly, often I saw nurses crying because they're not just nurses in their own world outside of their career. They have caring responsibilities, and so hearing carer journey and someone else's story was resonating with their own experience, and they were dealing with their ambiguous loss and grief around their circumstances as well. So it's really lovely to be able to refer them to support services and to hold the moment for them to have that emotional response to what they were seeing or hearing in the training. A lot have concerns about the cumulative effect of trauma. They're exposed to people at their worst consistently. They've been, nurses reported being pushed, punched, kicked, feeling threatened, having to deal with people who are in psychotic situations or in paranoid episodes, and being exposed to that over a longer period of time. They felt they'd become cynical, and it was difficult to maintain their compassion. So it was really lovely to help them re-energize their compassion and empathy. Very few had read their policies around privacy and information sharing. So they were relying very heavily on their training. And so I was able to encourage them to be really up to date with what their service says they should be doing and not doing, and what's actual law and their responsibilities from a legal perspective. But the overriding thing was that they love their work and they're genuinely wanting to make a difference. And I thought that was really noteworthy. It should be shared with the broader Australia. There were three current gaps in the system that I identified. The first one was that there was a lack of care information packs. They were either not created, so they were using just generic carer packs, or they were not consistently handed out, and there was no one responsible for this. This needs to change. It needs to be systemised. It needs to be the carer pack is given out at this point or in this way, and that it's checked off and that there is someone that's responsible for them. So that was the consistent across all of the services, the main number one highest rating gap. The second one was there was a lack of systemic inclusion, and it was reliant on clinicians to determine where family members might be engaged. And often that was too late. It was just before discharge and often at very short notice. So quite inconsiderate of the family needs. So that's something also that needed to be changed for there to be more consistency and more respect given to the family and friends. And it was also not inclusive of carers in treatment planning. They're often kept outside of the loop and not informed. The third was that there's a lack of professional development opportunities. This is the first time a lot of clinicians had any carer engagement training. So there's a need for a consistent integrated training on carer engagement to be added to the corporate training.